Hello, my name is Alonda McFarland, and this is a physical exam video done for health assessment. Teresa Cumberland is my patient, and like I said, my name is Alonda McFarland. Good morning, Teresa. How are you?
I'm great.
I'm going to do an assessment of your skin.
Okay.
Have you noticed any irregularities of your skin? Any moles, any redness, any yellowing of the skin, any dark tint of the skin, or anything?
Nothing.
Have you noticed a change in any moles that you may have on your body?
No.
Have you noticed any redness, any darkness, or any growth in those moles?
No.
Okay. For this video purposes, Teresa does have her clothes on. If we was in an actual clinical setting, Teresa would be undressed, she would have on a gown, and I would be able to see her entire body, not just doing this assessment through her clothes. Teresa, can you let me look at your arms? This time I'm checking her skin. Her skin is nice and smooth. I don't feel any sores, any open area. Skin is nice, warm, and dry. Look at your nails. I don't see any swelling anywhere. Nail beds are nice and round, pink. Blanching is fine. Capillary refill is less than 3 seconds. Nails are nice and intact. Once again, there's no edema, there's no redness anywhere. Now your head back, I'm going to check your elasticity of your skin, which it rebounds well, which lets me know you're nicely hydrated. I'm going to use this ruler to check for clubbing of her skin, of her nails. Okay, let me use this one. Her nails are right at the 180-degree angle, which means that there's no indicator for any lung or heart problems or any COPD. This time I'm going to look at her legs just to make sure everything is nicely intact. Once again, this is for video purposes. If we were in an actual clinical setting, she would not have these socks or shoes on. Skin is nice and warm and dry. Skin is intact. There's no edema. There's no swelling. Is there any pain to these lower legs,
No.
Teresa? This leg has no swelling, no redness. Skin is intact. Nice and warm and dry. At this time, Teresa, I'm going to look at your scalp.
Okay.
I have to get on my tiptoes because she's taller than me. But I'm checking her scalp for any irregularities, any protruding of the bones, checking her skull for any for anything that shouldn't be there. Scalp is intact. I don't feel any swelling. I don't see any moles. I don't see any open areas. Hair is full and thick. I don't see any breakage anywhere. No signs and symptoms of alopecia. Skin is warm. Scalp area is warm. The texture of her hair is good. Her skin is nice and uniform throughout. The distribution of her hair is nice and regular. Her nails, the pigmentation of her nails is intact. Pigmentation is normal. Now, Teresa, I'm going to ask you to lift your head up and down. I need you to move it from side to side. How does that feel?
A little stiff, but it feels okay.
Okay, no, you didn't have any restriction?
No.
No difficulty doing that?
No.
Good. Now I'm going to check, your face. I'm looking at your face for symmetry. Looking at your eyes, your conjunctiva. It's nice and it's within normal limits intact. See no redness, no edema, no drainage, no lesions. Open your mouth for me. Lips are nice and pink. In an actual clinical setting, she would not have this lipstick on. Gums are nice and pink. Teeth are intact. Good. Now I'm going to check, Now I'm going to check your cranial nerves. Looking at her teeth, also was checking cranial nerve 5. I'm going to now be checking for cranial nerve 5 again, checking with the cotton ball. This is soft, Teresa.
Okay.
Can you feel that?
Mm-hmm.
Okay. What I want you to do is close your eyes.
Okay.
And I need you to let me know when you feel this soft sensation. Okay?
Okay. Resistance.
Okay? And this is checking for resistance. feel it?
Soft.
Okay.
Soft.
Feel it? Is that soft?
Soft.
Okay. And now, Teresa, this is kind of pricky, okay? This is kind of dull, hard.
Okay.
I need you to let me know when you feel this, okay?
Okay.
This is not intended to hurt you.
Okay.
Feel
Okay.
it?
Sharp. 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 Sharp.
Okay. Now, I'm going to be checking for cranial nerve 11. And this right here is going to be checking for resistance, Teresa, okay?
Okay.
I want you to try, wherever I put my hand, I need you to try to move towards my hand, okay? Good. 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 All right. I want you to shrug your shoulders up. Good. Did you have any difficulty doing that?
No.
Any pain?
No.
Any distress doing that?
No.
All right. I want you to do range of motion with your shoulders. Let me see you do that. Okay. I'm going to look at your trachea. A jugular vein distension. Is there any pain or any discomfort in this area?
No.
Okay. Let me see you swallow, Teresa. Any problems with that?
No.
Any difficulty swallowing?
No.
Okay. This right here concludes my skin, head, and neck assessment.